Hi there, my name is Selena and I will be prepping Fluffy for today's surgery. I just have a few questions for you. First one, when was the last time Fluffy ate?
12 hours ago.
Perfect. And any medication? No? Perfect. Any coughing, sneezing, vomit, diarrhea? No? Perfect. Okay. Now, there are some complications that can arise with anesthesia, and I will go over them with you. Some of the risks of anesthesia include cardiac arrest, respiratory arrest, and organ impairment. It mainly can affect the liver and the kidneys. I know those may sound scary, and I know you're worried about the upcoming surgery, but I want to assure you that our team is doing everything and taking every precaution possible to make sure the surgery goes smoothly. Some of the things we're doing, I'll let you know, it's right here. The first thing we are going to do is take a physical exam where we will examine him for any abnormalities and enlargements of the liver or kidneys. We will also listen to his heart and lungs. And then after that, we will do blood work. Sorry, just checking again. Blood work to ensure that both the liver and the kidneys are functioning properly. And if not, we will be able to get the proper medication in order to prevent any damage to them that we can give before or during surgery. The next thing we will do is an x-ray and ultrasound just to check again to make sure there's no abnormalities in the chest area. And just to conclude it with our physical exam. And then another test we will do for the heart is called an echocardiogram, where we will observe the chambers, valves, walls, arteries, veins, and aorta just to make sure his heart's working perfectly fine. And during the surgery, we will have previously set up emergency medications that will be used should it be needed. In seconds, there will be an anesthetist and an assistant monitoring his vitals. And, sorry, just one second. And at all times. He will be monitored at all times and will be hooked to an IV to maintain hydration, blood pressure, and to quickly administer any needed drugs. He is in good hands, and I want to reassure you that we will take every precaution necessary to make sure his surgery goes.
Physical exam and blood work have been completed on Fluffy, and he's ready to go.
Okay. The first step is to give the animal pain medication. This medication makes the dog a little tired, and then I will administer the anesthesia to sedate Fluffy. Right now, we are going to place an IV catheter. We place the IV catheter because this gives us access to the veins during surgery in case anything goes wrong. Oftentimes during surgery, blood pressure may drop, so when it does, we have quick access to the vein, and it's always good to be prepared in case something happens. The patient gets hooked up to an IV line. Fluids will be maintained during surgery because this helps staff keep an eye on the animal, on their blood pressure, and this helps keep our patient hydrated. Now that the IV line and fluids are now in place, we now begin the induction part. We are administering propofol, which is a very good induction agent. The tube is tied around the patient's nose to keep it from slipping back into their airway.
First, I'm going to shave the incision site to make sure that it is a sterile area for the surgery to be performed. Now I'm going to vacuum up any excess hairs to once again ensure a sterile area. Once that's done, I'm going to use a soap called chlorhexidine to clean the area of any debris and just start with the base clean. Now I'm going to use alcohol to disinfect the area and remove any oils or soaps. And lastly, I'm going to use iodine to sterilize the area, but the way you put it on is you start at the incision site and you work in a spiral motion outwards, slowly, working your way away from it. And now this patient is prepped.
This is the anesthetic machine. We are now connecting the tube to the anesthetic machine so that the gas connects to the airway. We then set the dial to the required amount so that the patient will be receiving.
I'm now going to check his airway. It's good. Also, I'm going to be putting lubricant on the eyes to make sure they stay lubricated throughout the procedure.
This protects them from drying out during the procedure. Now that the animal is under anesthesia, we now bring them to the surgical room. We have hooked the patient up to all anesthetic monitors, and we are monitoring the animal's pulse and how much oxygen is in the body. It is important to monitor the oxygen levels because if they're too low, that can result in brain damage. The point of all these monitors is so that we can adjust the anesthesia if something goes wrong. I am now attaching the item to the tongue to monitor the blood pressure. There is also a cardiogram ECG attached. Everything is running well on the machine. We are now monitoring the vital signs and checking the mucous membranes every 5 minutes. The mucous membranes are pink and moist. The heart is in normal range. Blood pressure is good. Temperature is a little lower than I'd like. Can we get some heating blankets in here? Respiration and oxygen levels are good. Thank you for the heating blanket. Capillary refill time. The capillary refill time is 1 second, which is in normal range. Blood pressure is 100/80. Everything looks good. We'll keep monitoring in 5 minutes.
The pack has been sterilized in the autoclave and is now safe for surgery.
These have been sterilized in the autoclave, and I'm now going to dress our surgery. First up is the gown. Now the gloves.
At this time, they are all wearing masks. It's a beautiful day to save lives. Today we're performing a lumpectomy. We'll be removing the mask from the abdomen. Scalpel, please. Scissors, please. Suture, please. Silk. How is the patient in regard to the depth of anesthesia? Are the vitals good?
Vitals are good. Temperature is within normal range, and anesthesia depth is good.
That's what I like to hear. Now I will finish stitching up the patient. Patient can begin to come off the anesthesia now.
I am now adjusting the dial and removing the tube from the patient's neck.
Hi there. The surgery went great. Fluffy is in recovery in post-op. I just have a few notes on the surgery, just to let you know how everything went. He was fully monitored under general anesthesia, including his blood pressure, continuous echocardiogram, he was intubated, and the anesthesia was maintained under the gas. The surgical procedure that was accomplished today was called a lumpectomy, which is a veterinary procedure to remove a abnormal growth or mass on the skin. Pain medications were administered after surgery, and we will give you some to take home with him because he's going to need it for the week. And any other notes here? We were able to get rid of it. Everything's good. We should have a speedy recovery. There is a follow-up appointment that will be done in a week, so we will book that for you, and you can come back and we'll remove the stitches. He does have bandaging. If it gets a little dirty or anything, you can replace it. Would you like me to show you how to do that? No? Okay, that's great. And any other questions or concerns? want you to take time choosing our hospital, and we wish Fluffy a speedy recovery.